Welcome to our third conversation about COVID-19. The topic today is supporting resiliency in patients, families, and healthcare staff. So we appreciate that you're here. We've got about 27 people on the line. I'm going to wait for just a minute to see if a few more are going to be able to join because we had 99 people sign up. And I know that sometimes it's hard to get away from one Zoom to the next, given everything that's going on in healthcare right now. There should be a poll in front of you, and my hope is that you'll be able to check the poll. It really asks you to identify what is the role that you play in partnership in the healthcare organization. And you'll see that it goes from patient to and family advisors and covers the gamut of other healthcare professional roles. And for those of you that don't fit into those categories, we're glad that you're here as well. And feel free to click other and join in the chat to let us know a little bit about you. I know at the beginning of the chat, we had Paula join us from Angel Flight West, and she shared a little bit about what they're doing and hoping in connecting with healthcare workers and organizations to provide support and help in this time of COVID-19. Marie, I see that you're on as IPFCC, so I'm hoping that you're going to be able to close the poll when you feel like we have enough responses, since it doesn't seem to be working for Natasha.
We have, right, and we have a little less than half of the people, so
Great.
I'm happy to close it when people are still joining. Just so you know, we have 46 people.
We'll wait for just a second. I'll go ahead and introduce the staff that are supporting this COVID-19, supporting resiliency in patients, families, and healthcare staff. IPFCC is joined by our programming specialist and Vice President of Programming and Publications, Marie Abraham, and she will be monitoring the chat and helping us keep track of things, including the polls. Natasha Reed is our registration and database manager, and without her, we wouldn't have the technology up and running. So thanks for joining us, Natasha. Today's conversation is going to be shifting a little bit from what are the processes that we have in place for our healthcare organizations and to maintain safety and reduce the spread of the virus, but to talk about what are the impacts that these temporary policy changes and disruptions to our routines have had on people, and how, what are we doing to take care of ourselves, to support others, and be creative in nurturing strong partnerships. So we hope that you've come to join us for that conversation. We believe very sincerely that it is important for all of us to contribute in these conversations. They're very participatory in nature, and we don't presume to have all the answers. What we're hoping is collectively the wisdom that's in the virtual room will be able to highlight some of the important steps that people are taking to maintain resiliency in this situation. I'm wondering, Marie, Marie is a mind reader. She has closed the poll, and what you can see is that we have over a third of our individuals joining us today are patient and family advisors. Thank you for joining us. What I know about this last little time that we've been, might seem like a long time, but that we've been dealing with this pandemic, that patients and family advisors are very interested and open to participating in virtual ways to support what's going on in healthcare environments. We've also got coordinators responsible for patient and family-centered initiatives, and you really, we appreciate you joining because you really are the stewards of patient and family-centered care and the voice in the healthcare organizations and in the community, helping maintain those relationships and those connections. We've also got a number of patient experience personnel, administrative and clinical leaders. As a quality improvement specialist myself, prior to joining IPFCC, I always love when we've got somebody who's involved in quality improvement and measurement, as well as some physicians. And community programs are so important. It's those relationships and connections that we have with our community programs that are really important. So we'll go ahead and close that poll. And I'm wondering, Natasha, if we can go to the next slide. Just wanted to remind people who may not have participated in a PFCC Connect conversation that we encourage you to use the chat freely. We'll start by having you chat in your name, organization, and country. I know we have a number of people from the US and Canada who often participate, and it's just nice to know where you are in this virtual world that we have. We are going to load the resources and a recording of this conversation onto PFCC Connect in the PFCC Connect conversation folder. So for those of you that have colleagues that aren't able to join us live, you can certainly share the recording with them, and it will be posted and kept on PFCC Connect as people join that community. Marie, as I said, is going to be our chat monitor, and she does a great job. So she'll be keeping track of all the conversations that are happening. I see some familiar names and faces on the call, so thank you so much for joining us. We're going to go ahead and do one more poll. The last one was around roles, and the majority of people are patient and family advisors and PFCC coordinators, as well as other colleagues. And if you can help us understand what setting or environment that you're working in, and what you'll see is anywhere from primary care down to continuing care communities, home health, and then community nonprofits and government organizations. And again, if for some reason we haven't indicated your setting, we encourage you to click on other and help us do that. And thanks everybody for sharing where you're from. We've got people from North Carolina and Michigan and the West Coast, as well as Texas, children's hospitals, as well as adult hospitals. So this is great. So thank you so much. We'll give you just a minute to complete that poll, and then Marie will share what the results of it are. Sometimes knowing what settings that people are in can help us identify what is going to be the direction that the conversation might go. And again, you as participants will guide that conversation as well by sharing questions that you might have in chat and or jumping in and sharing thoughts and considerations. In just a minute, I will kind of set the stage for our conversation, and then we'll get right to it. So Marie, can you just check in with me and let me know how we're doing on getting that poll filled out?
Mary, we have about 71, so I'm going to close it now.
Great.
There you go.
Okay, so we've got the bulk of people represented in hospital and medical centers, and then a smattering of primary care, ambulatory, and community nonprofits. So I really encourage us to have the conversation, and it may be that you drive the conversation to really talk about what's happening in hospital and medical centers. But I also encourage those of you from other settings to share your experiences and your thoughts and questions, because what I know is that sometimes when we're talking about partnerships and resiliency, that strategies that happen in one setting can happen in another, and they're not necessarily exclusive to different settings and environments. So if you want to, Natasha, go to the next slide, that would be great. So when I was thinking about the conversation and looking at the things that people have filled out in terms of their evaluations of our continuing conversations, and looking at what's happening kind of out in the community, one of the things that really struck me as an important topic based on your feedback is the whole topic of resiliency. And so resiliency is defined in a number of ways, but what I often saw in my scanning of the environment is that resiliency really is the ability to bounce back quickly from temporary setbacks. And while I believe that it doesn't feel like this is temporary with this pandemic because of the intense nature of it, it will not always be our 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 reality. It will certainly impact our future, but we do we do want to be able to be resilient and be able to bounce back. And so we need to do that in the moment as well as over the long term. And so that's why we thought this might be an important conversation to have. Natasha, can you go to the next slide? There's all kinds of material written about what creates resilience in individuals. And these are just a number of things that are areas that can impact an individual's resilience. And from the ability to be flexible and adapt, to have confidence and belief in your ability to bounce back based on your prior experience of other difficult situations you might have found yourself in, the ability to laugh, to take your attitude and think about what can I do, as opposed to what can't I do, and looking for ways that you can create some control in your own environment. So, um, so these are some of the things that when you go through the literature and you're looking at the evidence about what creates resilience in individuals and also in organizations, these are some of the general categories and concepts that are important to be thinking about. If you can go to the next slide, Natasha. What I am interested in knowing, and this is where we're going to use the chat, is what have been some of the challenges you or others have experienced as part of the COVID-19 experience? And if you can chat them in, um, we can see what are the things that we have in common as individuals, and maybe what are some things that we want to, as a community of learning, know about challenges that others, perhaps in other settings, are having, so that we can share our wisdom with each other about what is helping. So as we watch for the chat to be um, uh, uh, filled in, the the thing that I'd also like you to think about is, what is it that's really helped you, or ways that you've really helped others. What I notice is that there is getting to be some indication that sometimes people get a little burned out on Zoom, because you're right, Carolyn, everything is transitioning to virtual meetings. And I saw an interesting commentary, I think it was in Health Affairs, where it was really encouraging people sending messages about how to respond to the pandemic, that we shift our language from social distancing to physical distancing while maintaining social connection. And what I see in some of the chats that are happening is that it is something we need to be mindful of. How do we keep that connection on a human scale with our coworkers, with our patients and families, advisors, with their institutions, and the individuals that they've built relationships with? That is really important. It is very difficult for frontline workers in particular to see the impact that, in terms of physical and emotional distress, it's the COVID virus is having on individuals, both those who have it and their family members. So these are all things that are difficult, and not things that we would have chosen or even imagined we would experience in our lifetime. But it is very important to um, tap into that which has helped us in past difficult situations, although they might not at all be anything like this. I certainly in my lifetime haven't experienced anything like this. So if we can shift to the next slide, there are some things that, based on resiliency, are things that can be helpful and useful in supporting an individual's resilience and that of other people. And I know that all of you serve, you, self-care is really important. So if we can bring that poll up. But there's also that whole role that we play with our loved ones, with our patients and families, with people that we're in relationship with in our work environment, where we both support resiliency and develop that in ourselves, but we also want to support building a resilient attitude and approach to with others. And sometimes we can lead the way by demonstrating and modeling that resilience. When we were looking at the information that came through in terms of questions that people wanted to talk about, I was struck by the fact that someone wrote in resilience and resiliency can be a learned skill. And I think that that really is true. And so sometimes it's important to remember that we can continue to improve our resilience and support the resilience of others through those connections. So if we can take a minute.
Mary, we've got about 64%. So and
Okay.
people are still filling out the poll. So
Okay, well,
we
we'll
can give
just
it a
leave
few
it.
more minutes.
We'll leave it for just a few more minutes. And for those of you that have already filled out the poll, if you can be thinking about perhaps an example or a story that you can share about what has been working for you once we open up the lines.
Okay, I'm going to end the poll. We've got
Okay.
a good.
Great.
Here we go.
We'll take a minute to take a look at this. I think it's interesting that 79% of people are finding that taking breaks from watching and reading and listening to the news is helping kind of give a mental break. It's not that we want to totally disconnect from what's going on, and certainly if you are in healthcare on the front lines, you are not able in your day-to-day work to disconnect from that, but it is important to take mental breaks. And I see a fair number of individuals doing self-care kinds of things. I wanted to just bring to your attention that while only a little over a third of you are identifying and acknowledging the important contribution you and others are making, I think it is really important to step back and acknowledge that that is happening, that there are stories of connection, there are stories of people being creative about how to connect with individuals, and we really want to be able to celebrate that even in the midst of the pandemic, whether it's individuals shopping for their neighbors or taking care of family members or sharing jokes or having a light spirit around other kinds of things and looking for what is right with the world. It's really important. So let's go ahead and go to the next slide, and we'll go ahead and close the poll. We've got an idea of what are the things that people are interested in. So these are some of the things that people were interested in hearing from their colleagues about in terms of learning from each other. So what are people doing to support the resiliency of caregivers? Caregivers being family members or loved ones who are in the lives of patients. Healthcare workers, non-COVID and COVID patients, what are some useful practices that have been put in place? And you can continue to read the other areas where people wanted to have conversation around these things. There was also some interest in are there some things we need to pay attention to related to cultural sensitivities as we're building and sustaining both our resiliency and the resiliency of others. And so what I'm interested in doing is going ahead and opening up the phone lines and having people begin to share related to these particular topics. And I'm noticing that Brenda,
Mm.
Andreas, you have some messages around the rural setting and what have been some of the responses of resilience in rural, smaller communities. Do you want to take yourself on mute for a minute and tell us a little bit more about that?
Brenda?
Hi, it's Brenda. I'm trying to unmute.
You're
Okay,
you're unmuted.
thanks,
I live in
Brenda.
a small rural Saskatchewan community, and we're very fortunate. We have a population of 1,800. Most of us have been here 2, 3, 4 generations. We know who our neighbors are. We help our neighbors. Our issue in our community has been that we're, and how do you say this? That we're very blessed that we've had no cases of COVID hospitalizations within our community, but we have a lot of frail elderly who require ongoing services and more related to the determinants of health. So I have just seen an outpouring of various community organizations stepping up, like the food bank, like the church groups, neighbors helping neighbors to get things done. What's been missing for us is the mixed messages that we've been receiving from the healthcare system around don't come near us because we don't want to catch COVID. And for people in a rural area, other than the post office and the grocery store and the gas station and your primary health center, your healthcare providers, particularly here in Saskatchewan, those are also our friends and neighbors. So people have been really hesitant to follow through, to go to the emergency or to phone the clinic when they've needed a service. But on the other hand, they're really loving virtual care now. So I'll stop
Mm-hmm,
there.
mm-hmm, mm-hmm. You know, it's interesting. One of the exercises that people often recommend individuals have during difficult times like this is to make a list of the silver linings that are happening. Not to be a Pollyanna, but to recognize that even in loss, there's gain, and the virtual connection can be a silver lining. I would imagine, especially in rural areas where if there's a lot of travel to get access to care and information, if we can do that virtually, that might be could be a kind of an unexpected benefit of the pandemic. But it is an interesting point that you raised related to how is it that we communicate with our healthcare workers in the rural area, but also in the urban area, how much we care and are concerned for them as well as for our frail elderly that are in their homes during this time and that kind of stuff. So it is really important to think about how we do that in a way that communicates that caring and concern without putting people at risk. And being able to message information in a consistent way can really help reduce anxiety. So those are all, Brenda, really good comments to share. What other kinds of surprising things or helpful things have people seen in their communities that have been useful and have kind of raised people's spirits and morale during this time? Remember, if you have something that you want to share, you want to be sure and take yourself off mute. I saw that Tanya Lord was on the call, and she's with the Foundation for Healthy Communities. Do you have something that you might want to share related to the work that you're doing or what you've seen happening in your community at large, Tanya?
Sure. Hi, Mary. So, well, I think that all of the difficulties that we're seeing are the same. I am working with, so I'm in New Hampshire and I work with all of our healthcare systems. And one of the And one of the pieces that I'm doing is bringing together our Patient Family Advisory Council members from across the state virtually so they can connect with each other. A lot of our hospitals want to bring them together, but some of the smaller rural hospitals just don't have the capacity. And then there's been a lot of patient experience staff who have been furloughed. So just bringing them together to share ideas and support, and honestly to ask them some questions in terms of of um, in terms of some of the statewide things that we're looking at, and other ways that they can support their communities at this point, including meaning the healthcare community, but also just in general
Mhm.
the community. I think that in New Hampshire, we haven't had the surge that we expected with COVID patients, so we're right on the beginning to discuss how to open up the hospitals a little more. And I think one of the biggest where I've seen a lot of help with the patient family advisors, especially, is the idea of just saying that our emergency rooms are still open in our state. And I know that different states are experiencing or different areas of the world are experiencing this differently, but there's a lot of stress. And if I feel like I'm having a heart attack, or if I'm having stroke, I'm not supposed to go to the hospital, or is it safe for me to go to the hospital? And getting the message out, for some hospitals it's quite safe. They figured out how to do it. The PPE is not in short supply as it once was. But I think the biggest thing that I would like to see is just a lot of sensitivity and compassion towards people and their beliefs, whether that's other fellow healthcare workers, patients, or family members, or PFAs, because as this developed, there were so many different, I don't want to say misinformation necessarily, because they just were learning, right? This is so brand new to everybody that one day it was this, then the next day it's this. And now, the numbers, the projections are different, but having just compassion, and as opposed to, that feeling of like, oh my gosh, how could anybody, you know, how could anybody suggest that that would help,
Mhm.
or why, or people won't do this or won't do that, or, and there's so many debates, like, should you be washing your vegetables with disinfectant? Should you be, all of that stuff. But I think that in the healthcare world, when we're all so stressed, if we can just share a lot of compassion, and realize that everybody is got a level of fear in a way, universally, in a way we've never seen before.
Mhm. And it is really important to acknowledge that the feelings, all of them that we're having, are really normal in a time of crisis like this. And I really appreciate your reminder about how important it is to be compassionate. And then I also think about how is it that we might be able to um, begin to look at the messages and try to create some clarity within the context of, these are myths and here's what's working and here's our latest information. And the fact that information is changing, part of the reason, excuse me, information is changing is because the data is helping guide us to understand more about this particular virus, which we have never had a consideration about. I'm noticing in the chat that Lori Albers talked a little bit about how their PFAs have created a video to help build morale and appreciation, which really is an effort related to supporting resiliency among our healthcare workers. Lori, can you pull yourself off mute? Would you be willing to share a little bit more about how you created the virtual video and what kind of impact it's had in your area?
Sure. So we were trying to find a way to really build morale for our frontline staff. And I work for Children's Wisconsin, which is a pediatric healthcare system. And I reached out to my wonderful PFAs because they're all at home and most of them have immunocompromised kiddos. And they're all looking for ways to be able to give back. So I worked with our AV team, and virtually we did everything through iPhones, making sure we developed a script, we sent it out, everybody was assigned parts, they were able to take the videos on their iPhones and send them to our AV team, which put music to it and graphics and made a video for healthcare staff. And it was just reviewed by management last week, so it hasn't gone out to everybody yet. But it was great because we were able to demonstrate diversity within our families that we serve and really be able to send a very supportive message from our families to everyone. I just know there weren't dry eyes in the management room when they reviewed it last week. So that was really, it was great. It won't be shared publicly. It'll be only shared within our system to the healthcare workers and staff.
That's a great example. I noticed that, we've talked about in the chat about how much virtual connection we are trying to create with folks. And Joe Short mentioned that sometimes deploying the video technology to keep people connected can be particularly frustrating. I'm wondering if, Joe, if you want to get off mute and tell us what kinds of challenges you've had with deploying your video technology. Maybe others on the call have some ideas about things that they've done that have helped with that. And for those of you that have some suggestions and ideas related to ways that you've addressed the video technology challenge, that would be great for people to share. So I'm going to open it up to talk about strategies and frustrations related to video technology so that we can share best practices with each other.
Sure. Thank you. Thank you. Yeah, this is Joe Short with Amita Health. We're a health system out in the suburbs of Chicago. When you asked that question, that was the first thing that popped into my head because I was just dealing with it about an hour before that. And this has been an ongoing challenge with us where we see an immediate need when we go on visitor restrictions to reconnect patients, to maintain that connection in any way we can. So we're trying to get the virtual technologies that's available on all of our phones. We should be able to do this, right? And we're scrounging up iPads and any bit of technology we can. But I guess there's a lot of entrenched policies and processes just in healthcare in general that have, we're not a very agile industry to be able to move quickly on new technologies like this. And so it's been a recurring challenge of something that seems like such a seemingly simple solution has been challenging to roll out. So that just wondering if anybody else has had a similar challenge or found some novel ways to work around that. Thank you.
Great, thanks, Joe. I know that Karen Anthony mentioned some tips and best practices with Zoom. Do you want to talk a little bit about that and how you've used that information to help address some of the technology challenges?
Hi, this is Karen. So I'm with the PFAC at Children's National Hospital in Washington, D.C. And my experience is in bringing the PFAC together and having Zoom happen, which everybody's probably run into this issue where you have a large number of participants and they have a varying degree of experience with Zoom. So what I found helpful both in PFAC and in other platforms is when you send the invitation for the first time you're getting the group together, we added some sort of quick bullet points of make sure you mute yourself. Here, some etiquette tips, here's a link to a how to download it sort of thing, so that people with varying degrees of experience can work that out. And then also in other group discussions, sometimes I've seen that the facilitator does a very quick little icebreaker in the beginning to orient folks to how to find the chat function, where's the mute, maybe in a game format to make it a little fun, but it's useful for folks to sort of get a hands-on orientation especially when you're talking about folks that may or may not have ever touched this before.
That's great. One of the technology challenges that a particular primary care organization addressed was, and they were in a rural community, is that individuals didn't necessarily have iPads or iPhones at their disposal where they lived, but they did have transportation. And so what that particular organization did to remove that barrier was that they made appointments for people that were virtual, but they invited them to come to the parking lot. And then they were able to take out iPads to them so that they could have their virtual visit, because they were able to connect to the Wi-Fi that the organization, the clinic had, which I thought was a really creative solution. What they were looking at is what were the strengths and abilities of their population. What could they do? Where were their barriers, and how could they create a bridge? So I thought that was a creative way to think about technology in a different way. So looks like, Keisha, you've made some notes about the use of WebEx. You want to talk about a little bit about that, what you've done?
Sure. Hi, Mary. Hi, everybody. Thanks again for hosting such a helpful discussion today. We have a very diverse group, as I'm sure everyone does, of PFAC advisors. And we're dealing with different devices, phones, iPads, computers, laptops, tablets. And we have people who are just unfamiliar and uncomfortable using the platform. So I've reached out to them individually and set up, I've only had to do 3 private meetings, and we have a total of about 34 advisors on the council that I work with, who just were like, I don't know what I'm doing. Can you please help? You know, I really want to be part of this, but you know, I don't know what I'm doing. And so I've just set up a private meeting with them. It takes about 10 minutes. We run through the platform, have our short meeting, and then they are so excited to be part of the group when we have our actual meeting. So it's been really productive.
Oh, wonderful. And what I love is that it didn't take a lot of time. It just was enough to create some familiarity and some excitement about the possibility.
Exactly. Yes. And they were all so motivated to see each other and just connect. So it was just a great way to not have a barrier, keep people from, you know, participating.
It reminds me of taking something that you as a facilitator learned in face-to-face meetings, which is sometimes when you're in a larger group or a group that's unfamiliar with each other, that rather than open it up to the entire group, that you pair people off so that they can talk to each other and get some level of comfort, and then come back to the group so people can share their ideas, and people are much more comfortable because they've had the opportunity in a small way to build some confidence. And you've taken that idea and you've made it virtual to support them in being able to participate virtually. So that is just amazing and wonderful. And I'm thinking that sometimes we think, boy, will I have enough time to do those individual meetings? And yet when we think about the resource of the people who are on our PFACs or even within our organizations who may have a level of comfort with that technology, that may be a role that they can take with individuals. You can assign a very skilled technology person who's on the PFAC to connect with someone who just needs, you know, just a little bit of coaching and experience before joining the larger meeting. So as much as possible, if we can think about what have we done to create comfort and confidence and resiliency in people participating and feeling like they're making a contribution in a face-to-face meeting, and what are those tenets or those principles or those concepts that we can build on, and just ask the question, how can we create that structure virtually? That becomes really important. I am wondering, as I look at the questions that we've had, is there someone who has some comfort and is interested in talking a little bit about resiliency and building and sustaining resiliency, are there differences? Are there things that we need to be mindful of when we think about different cultural sensitivities? For those of you that maybe are in larger urban areas where you have a wider swath of cultures, are there things that all of us can learn from, that we should be keeping in mind? I know it's quiet, and it may be that someone doesn't have a particular wisdom to share about that, or it may be that you're on mute. So I never know when I'm facilitating these conversations whether it's a mute issue, or that might be something that we just kind of need to noodle on for a little longer and come back to that question in another conversation.
Yeah, Mary,
Yes.
you know, when people were chatting in their challenges earlier, I am, there were a few themes that came up that maybe we can throw it out to the group. And it was, you know, it was this idea that we're shifting back into a more paternalistic environment because of the restrictions. And that includes, I know Joanna Salenza and a few others talked about the language that's being used now. And I know we have talked about that before, but just in thinking about resiliency and, you know, how is it that shift back into previous ways, how can we respond to that? And if people have ideas, and so, or if people would like to talk about their challenges with that.
Mary and Maria, I would just offer there a few things. One, when talking about resiliency, Mary said something in the last meeting that we all had, which was to be forgiving of yourself, which has really stuck with me over the last few weeks, because I tend to be very harsh on myself. Like, what have I not thought of? What am I not doing? I'm sure others like me all over the country are experiencing the same amount of stress, because we're experiencing furloughs and people are being let go. And, you know, mine is not a revenue producing department. So it's that constant doggy paddling of how do we make ourselves relevant in the COVID era. And so all of the things that you did at the top of the meeting, I think, are really important. I was checking all of them because just even in the last couple of days, those are really important, I think, to keep our heads on straight and being able to get up the next day and do what we do. One of the things, you know, initially that was keeping me up at night was all of this new language that we've been trained by the Institute and others to never, ever use. And those words, absolute words that we all hate. So it's been really important for us to, and I have support from our Chief Quality Officer, that we not forget who we are. And so we've created a guiding principles document that I wrote with the help of patient and family advisors, that we're utilizing all this technology now, and that's great, but how are we ensuring that it's being offered when people get very busy? And you know, we don't want it to be a burden, but we want to make sure that we're not leaving our culture back where we were 5 years ago. So the number of times in which we offer it, whether it's a patient that's conscious or unconscious, to engage families at the bedside when they can't be at the bedside, which is absolutely critical to who we are. I have had tremendous pushback on a document that we put out, because at the top it says families are not visitors at MUSC Health. And people don't like that. They think it's very confusing. So I have to keep pushing back and saying, well, it shouldn't be confusing, because we're not letting anyone in the building anyway. Families, not families, whoever, you're not allowed in. But that is who we are. We take pride in saying that families are not visitors here. So we don't want to lose that language. We want to, and if we have to back it up some way to help care team members understand what we mean by that, then we can add a clarifying statement.
there are so many things that your organization has done that have been helpful to me when people get very busy. The emails that have been pushed out with language about things that we can still do together, I have used those repeatedly. The document that was sent out recently, much to my surprise, was read by one of our administrators, and she contacted me on Friday and she said, this concept of office hours, I really like that, and I think I want to have weekly virtual meetings with our patient and family advisors. And I said, oh, that suggestion was actually for people in my role. But if you as the administrator, and now our ICE chief, who's the medical director over all of Women and Children's, he's going to get on that call. And every week they have offered to hold these virtual meetings for all of our advisors to make sure, or at least in the Women and Children's part of our organization, but to keep them engaged, to make sure that they're knowledgeable about what's going on so that they will be ready, as you said in your document, so that they will be ready and engaged to answer quickly. I tend to rely on a few individuals because I know they're going to answer and respond to me in a timely way, because everything is happening so fast right now. When someone asks me for help with something, they needed it like yesterday. So I tend to reach out to the same people who I know are going to respond. But if we can engage all of our advisors in that way on a weekly basis, and our leaders are willing to do it, I mean, I was very surprised that in this busy environment that they read the document that I sent out, but that they actually are ready to do some of the things that were suggested by you. So, and then one last point I'll make is, for folks in my role, I think it's really important to find out what's important to your leaders. So I know our CEO has been very concerned about the Washington Post article, the idea of the vanishing patient. So where are our patients and what are they afraid of? So he said, just in the interest of self-preservation, if you can help us answer that question. So I've been sending out a lot of queries to our patient and family advisors, and that was one of them, which is, number one, are you afraid to seek treatment or to come into one of our facilities? And number two, if you are, what can we do to help make you feel safe? And then sending that to your leaders to make sure, because that's really important to them right now. I feel like in many ways, our patient and family advisors are more important than ever to help them discover answers to some of the problems that are going to be faced with in the next weeks and months.
Mm-hmm. Mm-hmm. And what I love about that is it's kind of a two-pronged approach. What are you worried about, and how can we help? How can we address that? So that you're really coming from a place of wanting to know what's important to the patient and family population. And of course, you're building on the relationship that you have with PFAC members right now. And they also are a conduit to a lot of other people. They can turn around, I mean, virtually, they can turn around to their network, whatever it is, and be asking that question more broadly of their network and gathering that information up and bringing it back into the organization, so that it becomes not just about what they're worried about, but what can you find out about what your community is worried about, and bring that back to us, as well as asking about what might be able to help. So so I think that there's this untapped resource of thinking about the ripple effect. You know, you're dropping the stone into the pond of that particular pool of advisors, but they have tributaries. Oh, this is a great analogy, but they have tributaries to other places. So anyway, I'll get off that little analogy. But anyway, I know that Joanna Salenza had a very important comment that she made in the chat related to repackaging messages and things. And Joanna, I wondered if you wanted to join the verbal conversation and share a little bit more about that from your perspective.
Sure. So I'm with the Children's Hospital at Dartmouth-Hitchcock in New Hampshire. And I think some of the messaging has come out very quickly, right? Because so much of this pandemic, we've had to pivot really quickly with things. So policy changes have come through, and we're all at the receiving end of a lot of those changes. But I just feel like as a clinical space, we've been very thoughtful about our messaging. But I do feel like we're having to repackage some of the language that's being used on a broader scale. Mm-hmm. And it's a little distressing to hear the word visitor used over and over and over when we're talking about patients and families. So I would be really interested in partnering with some of these wise people on the call today to really think about how we can move this whole idea forward and upward perhaps, to think about language and the impact of language, because I think it really can be disempowering when we refer to families as visitors. I just feel like we've taken some steps backward, but I think as a clinical space, we have the appropriate leadership that really embraces patient and family centered care and true partnership. So I think our messaging has been very powerful and has really, I think we've kept true to our culture.
Mm-hmm. Mm-hmm. That's really important. And I think it's great to continue the conversations beyond on particular topics that people have interest in, like this language topic and how we maintain that culture and things. And I'm wondering whether or not one of the vehicles that you have through PFCC Connect is that there is the discussion posts that people can post and start a thread on a particular thing. We've and of course there's the all community discussion posts where most people put their discussion posts in the all member community, but we also created that you can join just by clicking on PFCC Connect, a COVID-19 specific community. And if any of you wanted to either post in the general community that language question and begin to pull together a group of people virtually that are interested in having, you know, virtual conversations about that, I encourage that. Or you can decide to do it within the COVID-19 community because it's specifically related to the COVID-19 response and some of the concerns and things that you have. But those are two ways that conversation can happen with a broader group of people, as well as the people that are on this call. The reason I'm mentioning that is that what I see sometimes, and it's a great thing and I encourage it to happen, is people might say, can I email you, you know, in the chat? And then a couple people get together and share information and learn from each other. And that's great, and I encourage that. And I also invite you to enlarge the conversation with the PFCC community, some of whom aren't able to join these calls. So thanks for bringing that up and for offering that, Joanna. And I know Kate Mayer had a comment related to that. Did you, in the chat, did you want to mention anything more, Kate, related to your comment?
Well, the language, because things are changing so quickly and people are very focused on safety and keeping everyone safe, they get very dictatorial very quickly. And so when I've been in a safety meeting and have been able to say, well, have you thought about how you're going to message it to the families? They're very receptive to that. It seems like that's a trick Marielle taught me. We work in the same institution of you know, a place where that is something we can really support with. Sometimes we can't change the message itself, but the language around the way it's said makes a huge difference in how it feels for people. And just to stop that sort of dehumanizing drive that is an unintentional consequence of the quick pace that we're all operating at now as new information keeps being discovered.
Yeah. And one of the things that's really helpful for the field and a shared learning is that as you're in those conversations, Kate and others, and you are looking at this one message and you're, you know, one thing that you want to share and you're talking about messaging, if you can pay attention to and capture, here's how it was originally going to go out, and here, after having had this conversation and some feedback from, you know, PFCC coordinators, or just getting that group to think a little more broadly and up a level, if you can share a before and an after to begin to help and share examples of how that language can shift when you shift the question of how can we message this in a way that supports that partnership and the value and respect that we have for patients and families. That becomes really important.
That's a great idea.
I also noticed that Kelly from Vizient, Kelly Goodson, did you want to share what you're doing on is it Friday, you're doing something related to elective surgeries and getting feedback from your patient and family advisors?
Yes, yeah, thanks, Mary. So at Vizient, we're a membership organization of hospitals across the United States and academic medical centers. And there's been a lot of talk about restarting elective surgeries, for some of the reasons that Caroline even mentioned, as far as, hospital staff being let go and furloughed, and people who've been waiting for procedures that were not deemed emergency or urgent procedures. So there's a lot of talk about restarting these surgeries, and at Vizient, we're just very concerned about how patients and families feel about that. And we keep bringing that up to our healthcare organizations that are considering restarting. And sometimes we have if you build it they will come mentality in healthcare, and that's not necessarily the truth or reality. So we quickly put together a panel of about a dozen patient and family advisors from across our membership, literally from New England down to Florida, across to California. And we're going to have a panel discussion with them around how they feel about this discussion of restarting elective surgeries, and what would they need to feel safe, and what would make them move forward with an elective surgery. So we're going to have a panel of these 10 to 12 patient and family advisors, but we are opening up for any patient and family advisor to listen in and to partake in polling questions that we're going to propose. So we'll send that out through PFCC Connect when we get the link. And we welcome all of our patient and family advisors. We also welcome our healthcare organizations to listen in. We would ask that you not take the polls, but you are welcome to listen in as well.
Okay, great, Kelly. Thank you for sharing that. I am looking at my clock on my computer, and I can hardly believe that it's 4 minutes until the top of the hour. This has been just a very lively and wonderful conversation. Natasha, if you want to move to the next slide, we're going to have to end it because you have other things that you need to do, but I have gotten some great ideas from this conversation, and I hope that you have too. I encourage you to use PFCC Connect, join the discussion, start a discussion. I'd be very interested in seeing before and after language information, and just have people really spend some time on that. I think you get it really down to your soul about that partnership and how important language is, and I think you could be a particularly valuable resource to the larger community. And when you share your examples and ideas with us, then we can integrate them as we did in the most recent document that we created, but we will continue to create new communications and learnings as you share them with us. So I think that that's really important. Next slide, we do have the COVID-19 site specialty or PFCC best practices on our regular ipfcc.org site. So we're adding things to that. And so we encourage you to use that as a resource. I found a couple other resources that I wanted to share with you, if you want to go to the next slide, that I found particularly helpful. This is the Greater Good magazine from Berkeley, and they are very evidence-based, and they've got some great articles on well-being during the coronavirus for healthcare professionals, for parents, for general community people. And so I encourage you to go there. I did kind of do a PDF of some of their common stuff on their website, giving them, of course, credit. It's not a fancy PDF. I just created it from the link. But you lose a lot of the links that they have to additional information. And so I encourage you to go to their website. I also, from the National Academy of Medicine, next slide, Natasha, found some information on strategies to support clinicians during the COVID-19 outbreak. And I think that is particularly important because it's a very stressful time, and And it's been going on for a while, and so we need to be very mindful of that. Kelly's shared the link if you want to go to the next slide in the chat. If you need that to the webinar, we will, of course, take all of this information, the polls, the chats, the materials, and put them in a folder for you, and we'll also send out a follow-up to you. We also, and I think that I'm going to ask Marie to put it in the email, but the next slide is about how important it is that you fill out the survey on your experience today, any ideas about future and continuing topics on COVID-19 that are going to help you in the work that you're doing to advance patient and family-centered care and to build partnership. Feel free to reach out to either Marie or I if there's something in particular that we can do, but that survey is really important. And so hopefully you can click on the link in that Marie just added and fill that out. It'll take about 3 minutes. We will be doing another one of these conversations in a couple weeks. We hope that you're well until then. Last slide, Natasha. So be well out there. Know that we care deeply about the work that you're doing, about you as individuals and human beings. We hope your families are well, and take care until our next conversation. Bye.
Thanks.